Good evening, everybody. Thank you for joining us. I'm Dave Lehman, former Providence Television news anchor and news director for many years. I also happen to be a parent. My wife Karen and I have 12 and 14-year-old daughters, so we're parents who are struggling with this swine flu outbreak just as many of you are. We have questions and also are looking for some answers too. Thanks for joining us for this most important program, H1N1, Swine Flu, What You Need to Know. It's brought to you tonight by the Rhode Island Broadcasters Association and Rhode Island PBS. The broadcasters, working with the State Health Department and the Governor's Office, feel that this program is a valuable tool for you and your family in helping to safeguard ourselves, our families, and our state from the H1N1 swine flu virus. Now, according to the Centers for Disease Control and Prevention, swine flu is now widespread in 48 of our states. Over 300 American deaths have been confirmed. 5 of them, unfortunately, here in Rhode Island. Of course, we have all been saddened over the past week or so with the deaths of 2 12-year-old Rhode Islanders, Victoria Souza of Bristol and Skylar Raposa Alves of Lincoln. Tonight, in a very small way, we would like to dedicate this program to them and to their families as we attempt to help others minimize their exposure to this very dangerous virus. And yet, we should all bear in mind that while millions of Americans are expected to get the swine flu, most of them will recover rather quickly, and they will do it without ever going to a doctor or a hospital. Tonight, we hope to accomplish several things. For one thing, we'd like to answer some of the most frequently asked questions about swine flu that have come to the Health Department or coming in today through our various lines. Our goal is to alert and not alarm. Our job here is to be temperate, not tabloid, and to inform and not misinform, since there is an awful lot of misinformation swirling these days about the virus and the pandemic. On hand to help us do this are several of the state's top medical, disease management, and public health experts. Leading our panel tonight is the director of the State Health Department, Dr. David Gifford. Before becoming the director of the department, he was a primary care physician and a doctor who specialized in the diseases and medical care for the elderly. Also tonight, Dr. Robert Krausman. He's a board-certified internist, a lung disease and critical care expert. He oversees the Health Department's Center of Infectious Disease. Dr. Nicole Alexander is also an infectious disease specialist caring for both adults and children. She's also an assistant professor of medicine and pediatrics at Brown University, which happens to be my alma mater as well. And Dr. Elizabeth Lang joins us tonight. She's a pediatrician in private practice here in Rhode Island. She is the president of the Rhode Island chapter of the American Academy of Pediatrics. So once again, thanks to all of you for giving up your time and being here with us tonight. Now, we're going to try to cover an awful lot of territory this evening, so we'll try to be brief and concise, both with our questions that really came from you, and the answers. We'll try to explain things in terms that you and your family will also understand. Dr. Gifford, let's get some of the basics out on the table as we begin tonight. We're talking tonight primarily about the swine flu, the H1N1 virus. Now, the seasonal virus tends to be much more impacting on the older population, whereas the H1N1, or the swine flu virus, tends to be one that affects a much younger population. Let's talk about who gets affected by this, because a lot of folks at home tonight want to know just how vulnerable they are and their family members, how vulnerable they are.
Yeah, seasonal flu tends to affect, as you say, the elderly. About 90% of the hospitalizations and deaths we see every year for seasonal flu is in the elderly. H1N1, though, has really been affecting the young adults and young kids. 80–90% of people getting infected with H1N1 have been young adults and young kids, as have been most of the hospitalizations and deaths.
What about the morbidity rate, the rate of which people die from this?
It actually, H1N1 is acting very much like seasonal flu. It's just that it's affecting so many more people. We're seeing a lot more deaths and hospitalization. But the actual rate and the severity is very similar to seasonal flu. It's just they're seeing 2 to 3 times the number of people getting sick. So we're seeing 2 to 3 times the number of young adults and kids dying and being hospitalized.
What about the overall planning for the strategies of dealing with this in a state? Now, we're fortunate we have a small state. We don't have probably the same problems that maybe a California, Texas would have, but we still have our own unique problems. What went into the planning of this?
Well, we've been planning on this since the summer. It's a little bit hard because the amount of vaccine that's coming in and our key strategy is to get people vaccinated because that's the safest way to protect from getting the disease, has been to try to figure out how to get the vaccine out to as many kids in as short a time period as possible, because we wanted to get kids and pregnant women first, because that's who's getting sick.
Okay. Now, it's my understanding that the Secretary of Education, Arne Duncan, has actually been very complimentary to Rhode Island about the planning. And in fact, we have been cited as being a model plan for this. Now, I know that there are some people at home might be saying, well, I'm not so crazy about this thing yet. We haven't got our vaccinations and so forth. But compared to other states, what are we doing that's right? Because it's good to hear some good things about the state in almost any venue, even if it has to be this one.
Yeah, I've heard that Secretary Duncan has made those comments about Rhode Island. We're, I think, the only state that has 100% of all our schools participating in a school vaccination program, and our vaccination program, though people in December, as you say, think they're a little bit late, is really the fastest program in the country. So we will get the most kids probably vaccinated in the shortest period of time.
Dr. Lang, let me toss this question to you. Again, these are questions that came to us through the health department's hotline, if you will. One of the questions was that we've been hearing a lot that vaccination is the best way to protect yourself. But how do we know that the vaccine is safe? And before you answer that, I was just over at the call center talking to some of the people over there, and I said, what are the main calls you're getting tonight? And several of them said we keep getting asked about the safety of the vaccine over and over and over again. What about that?
We know this vaccine is safe because it's made by the exact same processes and by the exact same companies that make the seasonal flu vaccine. And the seasonal flu vaccine has a very long track record of safety. So even though this is a new virus, it is a virus that's being put into a vaccine the same way that has been done for a very long time. And for that reason, we know that this vaccine is safe.
When I was over in Newport in Middletown yesterday on a business trip, I was coming back and I saw some signs on a stretch of 138 talking about, basically, I think, sort of scaring people about the whole question about thimerosal. This is an ingredient in the vaccine that has got a lot of people worried, and I think Don Imus has been one of the people around the country, a radio talk show host, as many people know. He has been this has been his issue. What do you say to people who have heard about thimerosal, that this is dangerous, that it could cause autism in children and so forth?
There are many international scientific studies that show that there is no link between thimerosal and health problems. Thimerosal is a necessary part of a vaccine program. That's the only way we can get the multi-dose vials put together so we can vaccinate the most people the quickest to get people as protected as possible against swine flu. So certainly parents have raised questions about thimerosal. Hopefully they realize that the scientific data does not support any concerns for the thimerosal and the vaccines, and they should feel safe that their child is better off getting the vaccine than worries about the thimerosal.
Did you have any doubts yourself as a grown woman in this community about this whole thimerosal scare early on? Did you have any thoughts about it?
Well, I think it's always appropriate to question things and answer questions with scientific facts. And the scientific facts lined up very squarely against any link between autism and thimerosal. This is a safe preservative, is removed from most childhood vaccines, but it is a necessary part of doing a mass flu inoculation program.
Now, it is not in every vaccine. The single doses, it's not in the single doses, I understand it. Is that correct?
Correct.
Can people ask for a single dose vaccine if they are concerned about it?
The reason why single-dose vaccines are made in a smaller number than the multiple-dose vaccines is because they take longer to make and they're harder to make. The goal is to get as many children and adults protected as possible, as quickly as possible. We don't have the luxury of time with this illness to wait until all the single-dose vials are made. And so we are encouraging all families to feel comfortable with the vaccine that is being delivered to their children in school and to get them protected now against H1N1.